Hi, my name is Elona Toska and I'm a researcher at the University of Cape Town, and today I'd like to present analysis from the Mzansi study in South Africa looking at preferences for long-acting injectable antiretroviral therapy among adolescents and young people living with HIV in our study. I'm presenting on behalf of a large team who I'd like to thank for their work in collecting this really large data set. Why did we do this research and analysis? We know that the health and well-being of the nearly over 2 million adolescents and young people living with HIV in sub-Saharan Africa is dependent on taking daily ART pills, whether single or multiple pill regimens. But we also know that adhering to retroviral therapy in adolescents and youth is quite hard, and sadly, non-adherence is linked to not doing well. Long-acting injectable antiretroviral therapy, which I'm going to refer to LAART for the rest of this presentation, if you see it in the slides, it has the potential to overcome some of the barriers that shape adherence to and non-adherence to pill-based ART regimens. But the majority of the research on this mode of ART is actually primarily focused on PrEP rather than treatment. So in the third wave of the Mzansi study, so we interviewed our adolescents and young people 3 times, as you can see here, over a 5-year period. We actually added a question about their preferences. If they had a choice, how would they receive their antiretroviral therapy? And this is the data that we're looking at today. We were very lucky that we followed our young people, and the young people were eager to participate in the study at high rates. We're able to follow up with nearly 97% of them, though sadly, in the duration of these 5 years, 3.4% of them were confirmed to have passed away. Who ended up being included in the analysis? We analyzed data from nearly 950 adolescents who were over 2/3 more than 15 years old at the time, just over half female, a quarter lived in rural communities, 1 in 5, 1 in 6 lived in informal housing. We observed they live in resource-poor communities with homes that were missing, 2/3 of the homes were missing at least one basic necessity, and high rates of orphanhood. Over 3/4 were vertically infected, and a small proportion, 1 in 10, were recently initiated on ART. We looked at the literature, but also at qualitative work from our team in the Mzansi study. What could shape the most, that was treatment-related factors that could shape the most preferring injectables over pills. And we came up with this list of factors that we later tested. We discussed with colleagues in the field, and we designed a simple question to test preference for ART delivery mode, keeping in mind that the adolescents and young people in our study had not been exposed to many other modalities of ART. Though the young women in the study would have been exposed to injectables and implant-on potentially, and maybe even rarely vaginal rings and products, such as the IUD, through family planning. We asked, researchers are developing many different types of medicine. If you had a choice, how would you prefer to take your ARVs or HIV medicine? And these were the options that we offered them. And this is what the adolescents and young people in our sample told us. As you can see, in purple and in black, so 86% preferred pills, and this is perhaps not surprising because they may have been taking them for a long time and are familiar with them. But then we look in the circle there, that's the gray and the orange slices, totaling 12% preferred injectables, either every 3 months or monthly. And it is these 12% that we compared to the 86% that preferred pills to see who were the adolescents who preferred injectables over pills. And if you remember the list of factors that we saw in the earlier slides, we actually found no difference by all of the factors listed here. So we didn't see a difference by age, whether they lived in a rural community, in informal housing, poverty, or if they were orphans, by mode of infection or mode of HIV acquisition, whether they were recently initiated on ART, whether they had a treatment buddy or attended a support group, we didn't see differences in preferring injectables over pills if they found it hard to take pills around a partner, or if they had struggled with taking a lot of pills recently, nor by retention and care and recent disclosure or learning of HIV. What made a difference was being male. So male participants were 33% more likely to prefer injectables. Those who had changed medications in the last year were 57% more likely to prefer injectables compared to pills. Those who had experienced hunger in the last week were 73% more likely. And perhaps unsurprisingly, those who had experienced medication side effects in the last year would prefer injectables over pills, and those who had experienced stockouts were 120% more likely to prefer injectable ART to pills. What we see here is that individually each of these factors was linked with preferring long-acting injectable ARTs, between 6 and 12%. But adolescents and young people who had experienced all of these factors, so who had had medications change in the last year, who were in a household that was food insecure, where they're experiencing hunger, who had had side effects, but also had not been able to pick up their medications in the last year, 1 in 2 of them would prefer injectables over antiretroviral therapy. And this is really interesting to us because, as we said in the title of our abstract, it's important for us to think, now that we have evidence and working formulations for PrEP, it may be worth considering how we can make this long-acting injectable antiretroviral therapy to those adolescents and young people who really struggle to take pills. And we have here some data on who those adolescents and young people are, and they're really, and it's really strong. We could really support at least half of them to actually be able to perhaps adhere better and have better health outcomes. I'd like to thank our team who did all of this. If you find any errors, they're all mine, and the amazing work is all of the colleagues named and pictured here. And a thank you to our funders and to all of you for listening.